Excluding COVID, I don't otherwise make many topical videos on this channel, but there have been a few issues that I've been thinking about lately, and I thought I'd talk about one of them today: patient privacy. The reason I've been thinking about patient privacy recently is because of a controversy that was triggered by a Twitter account that posted a brief video of a patient receiving care in an unnamed emergency room for what can reasonably be described as a sexual misadventure involving their genitals. Now, I haven't seen the video, I don't care to see the video, I do not recommend that you look for the video, but supposedly it also reveals the person's face. As far as I'm aware, this Twitter account that sent it out initially was not from a healthcare professional themselves, and normally this kind of tweet would mostly fly under the radar and would not raise too many eyebrows on med Twitter. But in this case, it was retweeted by several healthcare professionals, including one who could reasonably be referred to as a med Twitter A-lister. Now, I don't know the A-lister in question, and I don't follow her, but by all accounts, and from looking at her thread afterwards and looking over previous tweets after this came out, she looks like she's well respected in the community, and she doesn't contribute to the platform toxicity I talked about on here a few weeks ago. After people pointed out that the video violated the patient's privacy and was overall in poor taste, as it appears to have been originally posted for likes and clicks rather than education, to her credit, the A-lister immediately unretweeted the video and acknowledged the error. In the spectrum of social media blunders by physicians, this was a minor one, and I don't think the doc in question should feel any worse than I suspect she already did about it. You might think, okay, so what? It's not the first inappropriate, gruesome medical video to be posted online without permission, and it won't be the last. But in this case, it generated some interesting discussion on Twitter about the intersection of patient privacy rights and medical professionals on social media when they post things for educational purposes. And it raises the question about what specifically constitutes a violation of privacy. Folks on MedTwitter were very quick to condemn the video that triggered the discussion in the first place, but what about other videos or photos of patients, including those in which the primary intent behind filming and posting, as I said, was education rather than shock or entertainment? For example, a video of a person's jugular vein to demonstrate an important physical finding of disease, or a photograph of a skin lesion on the arm to demonstrate the characteristics that suggested it was melanoma rather than just a benign mole. Does it matter if a person's face is shown or not, or a distinctive tattoo? Does it matter what part of the body it involves? For example, what if the suspicious skin lesion wasn't on the patient's arm, but rather on their backside or their breast? What if it's pictures of surgeons in the OR operating on somebody, but only the surgical field is shown? I would not say there was universal agreement on this issue, but I think the general consensus from those on MedTwitter who weighed in was that any photo or video of a patient that is going on social media, regardless of body part, needs some form of explicit consent from the patient, though there's disagreement on what that consent should look like. A video in which the patient's face is clearly seen might require formal written consent, while a photograph in which the person's identity is not revealed in any way might only require verbal consent. Or maybe written consent should be obtained in both cases. This is an important question because it comes up all the time for medical educators on social media. I don't follow many accounts on Twitter, but of those that I do, some occasionally or even frequently post images of physical exam findings, often with some relevant details of the patient case. These are unquestionably useful for education, and I don't want to downplay that. They're really helpful videos and images. But although I suspect proper consent was often obtained to share the info on social media, it's usually not explicitly stated. And this is a problem for two reasons. One, because if consent was absent, it may be unethical and in some cases actually illegal for medical professionals to be sharing some of this stuff. But two, because when people are at home and they see these kinds of posts on social media, some may be more reluctant to seek medical care if they are worried that their body might end up on Twitter or Facebook or Instagram. I felt this acutely when making videos for this channel. There have been a few topics that warranted showing images of physical findings. These have not been my own patients, but they're rather images typically obtained from Wikimedia Commons. In the past, I had both assumed that consent was probably obtained appropriately originally, and considered that the image was already out there on the internet. I was not going to be the one who was going to let it loose, so to speak. And of course, momentary use in a purely educational video feels like a very different use than tweeting them out to the general public for quick retweets. But I no longer think any of these assumptions are as sound as I once did. And moving forward, I am going to refrain from using patient images in the future unless I can confirm that proper consent was obtained, which is admittedly hard to do. For the record, on the rare times that my videos use images of apparent patients without physical findings, including ones showing the patient's face, these are either licensed stock photos or are pictures of standardized patient actors who actually have signed written consents for their images to be shown online in this context. I know not everyone agrees. When I've seen this come up in the past on Twitter, and in response to a patient image, when a user asks whether or not consent was obtained, there is usually some degree of incredulousness expressed by third parties that we should give the benefit of the doubt that a healthcare professional would have obtained consent before posting something. They say, we should assume a medical professional on Twitter or on Instagram or Facebook was acting professionally. While many do, and some like, for example, Andre Mansour, a physical diagnosis PDX, they are very transparent about the consent they obtain. It is not a safe assumption that every clinician on social media is that careful and respectful of this issue. The history of medicine is full of examples of physicians and scientists using patient images inappropriately or without permission. And after all, I started this video off with an example of a respected physician sharing something inappropriate online just last week. If that's all the story was about, I might not still have felt the need to talk about it here. There is yet more, though. You see, some members of MedTwitter who were very vocally denouncing sharing videos of patients without their consent seem to have what I could describe as suboptimal self-awareness. Patient privacy can be violated by more than just images and videos. It can also be violated by sharing detailed and intimate stories of doctor-patient interactions. In fact, some of the most egregious violations of privacy that I've encountered on social media consists of nothing but text. I usually don't like calling out specific individuals on Twitter or YouTube because it can encourage brigading, and I think it contributes to platform toxicity. So please do not seek this person out and comment on his feed about this issue. Having said that, there is one MedTwitter A-lister who perfectly captured the lack of self-awareness we can have regarding patient privacy violations. And I just want to walk you through some of the things he said. So here he is a few days ago, or I think it's probably been about a week at this point. If you do not personally have consent to post a patient-related image or video, please do not post it online. If you do have explicit consent and do post online, please say so. Yeah, I agree. I think this is a reasonable take. But not only did this guy post this tweet, he followed it with dozens and dozens of comments within a 24-hour period talking about the importance of explicit consent and privacy. Fair enough. He seemed really passionate about it that day. That's great. People can be passionate about a topic like this. It's an important topic. But here's the problem, though. A 16-tweet thread, this same MedTwitter A-lister, an ER physician himself, posted in November 2020, in which he described an encounter in the ED with an apparent white supremacist and methamphetamine abuser presenting with respiratory failure. The physician not only implies respiratory failures from COVID, but he also implies the patient is an anti-masker, a COVID minimizer, and a conspiracy theorist, without any apparent evidence of this. He directly quotes him and talks about his goals of care discussion. He shares intimate details of what may have been the worst day of this man's life, and what may have literally been his last conversation on Earth. I very seriously doubt the physician obtained proper consent from this man in order to call him a racist to his 20,000 Twitter followers. There's a lot more to unpack here than just violating patient privacy, and my primary point here is not to call out any one specific individual doc on MedTwitter, but rather I want to demonstrate how easy it is to be blind to our own shortcomings with respecting patient privacy. The fact that this Twitter thread received 100,000 likes and resulted in a TV interview for the OP only makes the OP that much more blind and unself-aware moving forward. As I described, I've used images in my videos before that may not have always been properly sourced or obtained from a privacy perspective. I suspect many, if not most, of my medical colleagues on social media have done something similar, even if just retweeting a skin rash or sharing an inspirational patient-centered story. However, every time you see a tweet that's an image of a patient, or which is a story that appears to refer to a specific patient encounter, before liking or retweeting it, you need to ask, does this story or this thread cross the line? If the patient who is being referenced or being shown were to encounter this tweet, or for that matter, this YouTube video in which they are discussed or shown, would they recognize themselves? Might they conceivably object to how their body or their story is shared in this manner? One argument I've heard from people justifying sharing a patient's story or image is that it's okay to do if there is no PHI, that is protected health information, which is a formal designation of information that includes things like name, address, dates of treatment, or any other unique identifying characteristics. In the US, people might justify their social media post about a patient if it doesn't violate HIPAA, a complex collection of laws we have in this country which describes the use and disclosure of PHI. Here's the thing about HIPAA and patient privacy, though. HIPAA is a floor, not a ceiling. What that means is that in the United States, HIPAA is the bare minimum that a medical professional is legally required to do in order to protect the privacy of their patients. It does not mean that individual institutions can't institute stricter policies, and in fact many do, particularly when it comes to social media. And it also doesn't mean that we can't expect and demand greater concern and consideration from ourselves. Consider that HIPAA was signed into law in 1996, before the era of social media, and before most people could imagine something like Twitter even existing, in which an inappropriately recorded video of their swollen testicles could be shared online to 500,000 people over a few days. HIPAA is just not sufficient for the internet age. In my opinion, if your patient could identify themselves from your tweet, your YouTube video, your TikTok, or your Instagram post, and they did not give explicit consent to have their story or body shared on social media, you have betrayed their trust, irrespective of the presence or absence of legally defined PHI, and irrespective of how honorable or altruistic your motivation was. The problem is that none of us like to be called out for doing things that we believe is for the benefit of others, like sharing educational points. When I posted a video about the physical findings of cirrhosis, and it included a photograph of a man's swollen belly with ascites, that wasn't for social media clout. That was because it is useful to educate students about cirrhosis. If at the time someone pointed out to me the questionable nature of its inclusion, I suspect I would have felt defensive and would not have been sufficiently open to considering that perspective. Just like if the ED doc who treated the apparent white supremacist were to see this video, I have no doubt that he would be upset by my characterization of his famous 2020 Twitter thread, and he would attempt to justify it by citing the greater good that he assumes came from it. Unfortunately, these privacy faux pas, they can exist in our blind spots, particularly when increasing social media clout is clouding our judgment. But we as clinicians, we need to be better. Rightly or wrongly, healthcare professionals, we have lost a lot of credibility and the public's trust during the pandemic. We need to take any opportunity that we can to restore that trust. I'll end by pointing you towards a great tweetorial by OHSU hospitalist Avio Glasser, in which she provides some examples of how to reframe some questionably problematic tweets into solid, privacy-respective teaching pearls. I'll put a link in the video description.